Welcome all to this episode of Your Freedom Hubs presenting the Cash Market Patient. This is the Cash Patient where we're going to be concerned about taking care of your own health and what it's like to actually sit in the driver's seat, be in control of your health and your wallet. I'm your host, Jeff Cantor, along with Charles Froman. We have a number of great sponsors, and we want everyone to remember that we are the intersection for all the disruptors in the world, and we're just working a little bit to try to make things better for everyone. We are recording all these for posterity. Here's the master site. I'll give you a little sample of what that looks like. We also are promoted by a number of organizations. Like I said, we have an award-winning app that is going to be very timely for tonight because this is all about getting control of your doctors in terms of being able to set your own appointments, understand what pricing is, paying cash, and being able to let doctors be prepaid for their services. And we're going to actually have a site you can go to here, which is wowadvocates.com, to learn a little bit more about it. Now, as I said, we are being recorded, so this is an example of one of the locations. If you go to the main site and then hover over home, you'll notice information events, and that's kind of where we are at the moment here. So we'll kind of come back to this, but you'll see down here at the bottom, we have the future guests, and then all the links, as I just was describing, of where you can go to see these past episodes. And then also we are continuing the conversation. So after tonight, those that have been on here, rather than have it just be one and done, we're going to actually take all of these issues and move them forward. And there's an awful lot of important people that we've had the privilege of having on here. We're going to want to continue to move forward in that regard. But let's shift gears here and switch into where we are tonight. So let's bring us over to this listing for this evening's festivities. And I'm going to, Charles, take the driver's seat.
Thank you, Jeff. And if you want to push the mute button for everyone who's not speaking, that might help. And
sure.
If you guys can hear my kids in the background, I always have an entertaining house going on here during the COVID lockdown. So as Jeff and I were featured in Forbes for creating the cash patients that we need to fix this healthcare broken system, we've met a lot of entrepreneurs and activists around the world. And one big one is David Bellot from the Texas Free Market think tank down there, and he runs a doctors group, Free to Care, which is a coalition of other doctor groups. And one of those groups is Physicians for Reform, funded by C.L. Gray, Dr. Gray, whose colleague, Dr. Barbour, Scott Barbour, is sitting in for him tonight to talk about a healthcare for you proposal that President Trump has adopted in part for his big push in the election. And let's face it, you can't avoid the issue. It's the number one concern of patients and families and small businesses. And Republicans struggle to have a good message on that issue. Joining Scott is Elaine Parker with a small business reform group. And that is called, let me see here. Yes, the Job Creators Network Foundation. I want to get that phrase right. Sorry, Elaine. And the Job Creators Network Foundation was instrumental in another project with the president, not healthcare directly, but with the tax cuts and regulatory reform efforts. And everyone has to give Trump some credit there. He did get rid of some red tape to help that economy boom before the COVID crash. And given what's at stake with this election, both Elaine and Scott are pleased to present in more detail the Healthcare for You proposal tonight. So that's your intro, Jeff.
Very good. All right. Well, on that note, Elaine, I'm going to switch the sharing privileges over to you.
Okay.
And if you'll do the honors. Very good.
Okay, great. Thank you, everyone. I appreciate everyone taking the time to join us tonight. As Charles said, my name is Elaine Parker. I'm the president of the Job Creators Network Foundation. I want to give you a little bit of background about who we are and what we do. We are a national small business advocacy organization. We're founded by a man named Bernie Marcus. And for those of you who don't know who Bernie is, he is the co-founder of the Home Depot. And Bernie founded Job Creators Network about 10 years ago because he really felt like small business needed an advocate in their corner. And so what we do is we advocate on behalf of small businesses for lower taxes and less regulations, pro-growth policies. There's 30 million small businesses out there, and they employ about 60 million people. So you're talking about 90 million people dependent on the success of small business. And so that's what we do. And we do that through the media, through education. We have small business owner members who speak out in the media, and we help them amplify their voice on issues that are near and dear to small businesses and helping them prosper. I'll let Scott talk about Physicians for Reform. Dr. Barbour.
Hi, everybody. My name is Scott Barbour, and I'm a member of Physicians for Reform. Physicians for Reform is an advocacy group that's been working to promote free market medical reforms. It was founded by Dr. C.L. Gray, who unfortunately wasn't able to be here tonight, in 2003. And we've been working over the years at promoting and educating people on reforms that are centered around the doctor-patient relationship. And we were fortunate to get together with Elaine and Alfredo and the people at the Job Creators Network to kind of get together to work on a strategy for helping to implement this patient-centered healthcare reform plan. So one of the problems with the direction we're going in now, which is promoted by the Democratic Party right now, referred to as Medicare-for-All, really, when you get down to it, it simply means more government control. It eliminates your doctor and private healthcare. It's a one-size-fits-all, top-down, government-run healthcare system with no choice and high cost. It's estimated right now that a Medicare-for-All program would require $33 trillion over 10 years, which is just simply not tenable. And one of the most important things about our personalized healthcare plan is we are not them. So the Biden healthcare plan, again, is more government. It maintains the worst parts of Obamacare. We know that if they get in power, they'll try to restore things devastating to the doctor-patient relationship and healthcare in general, like the mandates. We're going to see probably a return of the death panels. There's little choice and a high cost for payers. Our proposal is a personalized healthcare plan. We refer to it as healthcare for you. It simply is a framework that promotes less government. It repairs and restores the doctor-patient relationship by increasing choices and lowering costs through innovation and competition. So regardless of what system we're looking at, Medicare for All is a speed train to single payer healthcare. The Biden plan is still a train that's headed towards single payer healthcare, not quite as fast as Medicare for All would be, but they're both heading in the same direction.
I'll pick up from here, Dr. Barbour. I'm going to play a short video. I hope everybody is able to hear it, and it'll just give you a little intro to healthcare for you.
The freedoms that we used to have as doctors and patients have been eroded over the years.
We have a healthcare system that no longer works for the patient, but actually works for the outside players.
The more people that get between the doctor and the patient, the less choice, the less control the doctor and the patient have over the care the doctor's going to give or the patient's going to receive.
Obamacare has not lived up to any of the promises. Medicare for All is simply Obamacare on steroids. If Medicare for All should pass, I won't be able to get into my doctor on time, and I won't get the procedures I need. And to me, that's life and death.
The healthcare system has really kind of forgotten about the American people.
Everyone needs the ability to customize a plan for them.
Healthcare for you.
Healthcare for you, a healthcare plan for the people, by the people, gaining tremendous momentum at the grassroots level.
What we want to do is fix what's wrong with the current healthcare system and make it better for all Americans so that there's more choice, more competition, and it's more affordable.
We need to make a system that puts the decision-making back in the hands of patients and their doctors.
Personalized healthcare instead of a one-size-fits-all that would unleash a flood of new insurance options. Former Speaker Newt Gingrich has endorsed the plan. Former HHS Secretary Tom Price has endorsed the plan.
For the first time ever, Job Creators Network Foundation has actually gone to people, thousands of voters, and said, what do you want to see in your health coverage plan?
When you start taking out the complexity of the system, things get less expensive because it's from me to my doctor and my doctor back to me. That's it. There's no one else there. Do you want a government-run system that's top-down, bureaucratic, very expensive, with no choice? Or do you want healthcare for you that's personalized, that puts you in charge of not only your healthcare decisions, but your healthcare dollars?
Okay, that gives you a little flavor. I'm going to talk a little bit about Healthcare for You and how we came to partner with Physicians for Reform. About 1.5 years ago, Job Creators Network Foundation and Physicians for Reform conducted some very sophisticated market research. Not surveys, not polling, but we did true market research. It's called discrete choice modeling for any of you marketing nerds out there like me. But we went out to 25,000 American voters, Democrats, Republicans, Independents, to find out exactly what they wanted in a healthcare plan, and just as importantly, exactly what wasn't important to them and that they didn't want in a healthcare plan. And what the research told us is that they wanted personalized healthcare. And the way that we're going to do it, is to repair and restore that doctor-patient relationship that's absolutely been decimated by Obamacare and all the bureaucracy within it. And we want to remove DC bureaucrats from the decision-making process and get them out of the exam room. And we want to increase choice and price transparency and competition so that healthcare becomes more affordable for all Americans. And so we launched Healthcare for You. I guess it's in October of last year, we officially launched. The research was done 6 months. Took 6 months to get all the research done. So we launched the marketing side of it, Healthcare for You. And we love the juxtaposition of healthcare. Do you want healthcare? Do you want Medicare for All, which is a top-down government approach, or do you want Healthcare for You, which is personalized healthcare? And so we went out there on the marketing side of it to help people understand and process what the policy was going to be, what the framework was going to be, essentially. And we did that through a campaign. Marketing campaigns, essentially to sell it to the American people through a dedicated website. For those of you who are interested, you can go to healthcareforyou.com and take a look at the framework, what our coalition looks like, who our endorsers are, and you can also see some more videos like you just saw previously. We went out there with op-eds as well in papers across the country, from national publications to local papers. Television appearances, like you saw in that video. Dr. Barbour was actually on Fox News talking about Healthcare for You when we launched it with our CEO. We also developed what I call a physician advocate program, which I'll get into that a little bit later in the presentation. But essentially, it's getting physicians out there speaking in the media because they're a trusted voice out there and talking about the issues related to healthcare reform and how to make it better for everybody. And we media train those physicians so that they're comfortable in the media. Dr. Barbour has been in the media 1 million times, so he's pretty comfortable doing it. We've run some commercials, and of course we've partnered and built a coalition with other physician groups like Physicians for Reform. We also launched our campaign at the same time that the Republican Study Committee launched theirs, and we had shared a lot of our data with them. And so there was a lot of overlap between our plan and the Republican Study Committee. And if you've been involved in the healthcare battle at all in the last 20 years or 10 decades, however long we've had this fight going on, you know that within the conservative community, there's enough people involved in it with very strong ideas that we're all always willing to let the perfect be the enemy of the good. And so by creating this healthcare framework and getting these organizations on board to partner with us, it's a framework. It's not a specific policy. It actually brought us all together because in theory, we're all on the same side and we all agree about all of these issues, from protecting pre-existing conditions to bringing down the cost of drugs, allowing more choice, having more price transparency. All of those things resonate with what conservatives want to see in healthcare. And so that was the whole point of it. Then it was talking about selling it to the American people as well. It's very much a bottom-up approach. You saw Dr. Tom Price in the video earlier. He's actually Job Creators Network's senior healthcare fellow. He's former HHS secretary and congressman in Georgia as well. And so he works with us now on Healthcare for You. And he always says that in his 30 years of working on healthcare, that he has never seen healthcare reform done this way. With this approach, because it's always so Washington-centric and all at the federal level. And so what we did was we said, let's turn this upside down. Let's go and talk to the people in the states. And so we created 3 levels of committees within the states. And we started with the state insurance commissioners because those are the guys that have to make healthcare work in their states. They actually deal with all the regulations and how to make it work so we can all get our healthcare legally, and they deal with all the federal regulations. So we have a state insurance commissioners committee. We also worked with the Republican Attorneys General Association and created a committee there, as well as the Republican Governors Association. And we have 2 governors co-chairing it, the governor of Nebraska and the governor of Iowa. And with that, we're working with the American Legislative Exchange Council to develop model state legislation so that as the federal government begins to, with Healthcare for You, the idea is to roll back the Obamacare regulations. And as they do that, we can create model state legislation that can be replicated from state to state. And so we're also working with Senate leadership to develop a Senate resolution that we're realistic in what can get passed, obviously, in an election year. But if you think in terms of Newt Gingrich's Contract with America, so think in terms of healthcare reform contract with America, if you've got nostalgia, if you're nostalgic like I am. But if you think in those terms of bringing a Senate resolution forward, that's the idea behind Healthcare for You. I'm going to let Scott talk just broadly about the framework in Healthcare for You. There's a lot more detail on the website that you can take a look at your leisure.
Yeah, thanks, Elaine. One of the most important things about Healthcare for You and your personalized healthcare network is understanding that there's really no way that a central planner like a federal government could put together a healthcare system that deals with 360 million people in this country. And so what we've done is put together a framework of ideas that allow individuals to work at the local level and to help promote the doctor-patient relationship. I've been in healthcare now over 20 years, and it's been a steady march towards single player. And just in the course of my career, the deterioration of the doctor-patient relationship because of the increasing interference with government bureaucrats has really led to increasing costs, doctors spending much less time with their patients, and we have so much other pressure on us to deal with electronic medical records and things like that, that the care of the patient almost gets to become an afterthought, or I shouldn't even say almost, they actually are. When a patient shows up at an emergency room now, there's a series of bureaucratic procedures that are put in place that really just help the system sort of fleece the patient for anything that's covered by the insurance plan. And what we want to do is get back to a system where patients only pay for the healthcare that they use. And that's really important aspect that can be promoted by healthcare transparency. Right now, we see costs that are exorbitant because they're paid for at the central level, and there's really no input from doctors and patients to sort of control that. But with pricing transparency, patients will be able to actually shop in a marketplace and become consumers of the healthcare resources that they consume. And that is going to increase quality and decrease costs and give patients greater choices. And we're already seeing that in places where their concierge medicine is in play, where patients actually pay a membership fee and they have a doctor that they know that knows their personal healthcare situation that they can get in touch with 24/7, that they have certain health maintenance testing that's very affordable and covered, and they have access to specialists as well. One of the important things about transitioning from this single payer government run healthcare scheme to a personalized healthcare plan is protecting patients with pre-existing condition. That's always been a very difficult thing. And one of the biggest problems is that if you put people with pre-existing conditions into insurance pools, they drive up the cost of the insurance care significantly. And that greatly affects the people who aren't sick in that network. And so what we want to do is create systems like high-risk pools in states where you can not put them in the insurance pool, but actually just pay for their care. It's much cheaper to just pay for the care of patients with pre-existing condition, and that can be spread across all of the people involved in a healthcare network. There's right now we have middlemen that called pharmacy benefit managers that send these rebates back that essentially are just middlemen that drive up the cost of prescription drug prices. So by increasing drug price transparency, we're going to bring down costs. Surprise medical billing, that's one of the only things where, you kind of show up to a hospital or you show up to a doctor's office and you go through your treatment and you sort of get your bill after the fact, and you never really have an opportunity to see what exactly you're paying for or to even make decisions about whether or not you want certain procedures or tests. You just sort of get the bill saying this is what you owe. The other thing we want is for patients to own their own healthcare so that they're not dependent on their employer to keep their insurance plans. And so we want to set up a system where patients own their own healthcare so that when they go from one job to another, they get to keep their healthcare plan. We also are promoting modernized healthcare procedures like telemedicine. In my practice, which is really, I was fortunate to sort of get away from this government-run system and start my own practice. I absolutely refuse to be a prisoner of electronic medical records and all of the Medicare regulations. And we implemented telemedicine a long time ago because it works for certain patients. And how do we determine which patients it works for? Well, that's between the doctor and the patient. If the doctor is able to obtain the information that they need through a telemedicine interaction and the patient is happy with that interaction, well, then that should be how that goes. And so we've been working with telemedicine a lot. Kind of one of the silver linings of this coronavirus pandemic is that it has sort of forced the medical field to really embrace these telemedicine interactions. And I think people are just seeing how powerful and effective they can be, and more importantly, how cost saving they are. And then we want to empower individuals to be able to choose their own doctor. I know President Obama often said, if you like your doctor, you get to keep your doctor. Well, what we really found was you're losing your doctor no matter what you think of them. And what we would like to do is create a situation where doctors and patients engage in a very healthy doctor-patient relationship, which involves trust and open communication, and allow patients to pick their doctors. And that competition is going to create better doctors that focus more on patients' needs and less on the bureaucracy of medicine. So if you look at the healthcare for you model, it's much more simplistic than what we saw with Obamacare, which you can see on the slide on the right. It's really not designed for you to understand. Nobody could possibly understand it. I've been in medicine for 20 years, more than that, actually, if you include my training. And I mean, it's just absolutely ridiculous. I can do a procedure on a patient. They need crutches. I can't get them crutches until I contact one of the bureaucrats at the insurance company, which takes a month to get approved. By the time the crutches are approved, my patient's already done healing from whatever procedure I've done. And I've spent tons of resources trying to get somebody in my office to contact somebody in their office to simply get them to say, yes, the patient needs the crutches. The system is really ridiculous. It's gotten very inefficient and very costly. And again, at the end of the day, what we need to understand is medicine is just like any other commodity that's dealt with in this country. It happens at the local level and it happens through the free market. You know, the market always knows how much we need of any particular resource, and things that people want end up being produced in abundance, and things that people don't want end up not being produced in abundance. And it creates choice and innovation. And that's what a healthcare for you framework does, is it allows individual doctors and patients to explore ways of delivering healthcare that work in every particular area of the country. And we know that patients in New York City have different needs than patients in rural Montana. And we should give doctors and patients the freedom to explore the best avenues for delivering healthcare in their particular situations. One of the greatest things, and honestly, I've been in this healthcare fight for probably 15 years in earnest, really committed to it. I've worked with a lot of these organizations that you see on this slide here. And there are a lot of great organizations there. And the work that Job Creators Network does, and especially Elaine, has done something that I've never seen in 15 years. And that's to really get all of these people that really have a lot of basic ideas in common. Our philosophies are very similar. We just got slightly different opinions on the details, but in the broad strokes, we're very in tune with one another. And Elaine has done a fabulous job of promoting conversation and dialogue between all of these groups, and sort of formed this coalition. I think Elaine was telling me is something like 48,000 doctors are represented with this group here, and we're growing every day. And it's really a wonderful thing to see, to get everybody on the same page and moving in the same direction, and not letting the fine details kind of get in the way of the fact that we don't want government-run healthcare. We know it's a disaster. We know it's failed everywhere it's been tried. And that, you know, I think if you look at what Job Creators Network did, and Elaine and Alfredo did with the tax reform, it was really powerful. You know, when that first started, they didn't really have the votes. There were enough Democrats who did not want to see the tax breaks, and sort of establishment Republicans that were against it. But what the Job Creators Network did was it got people that were business leaders to come out to campaign rallies and things like that, and really articulate the importance of these tax cuts. And I think what you saw with President Trump and these tax cuts is we really just had a loss of regulation and a decrease in our taxation. And you saw the greatest economy that we've seen in modern times actually explode. And the same thing's going to happen with healthcare. If you can just relieve some of the regulation that's preventing doctors and patients from working together, and reduce the government burden on them, you're going to see healthcare costs come down dramatically, and you're going to see innovation and choices go up dramatically. And I'm really proud to be a part of Jobs Creators Network and Physicians for Reform and a lot of these other groups to fight for free market healthcare. And this is kind of a beautiful thing. You see a lot of important people that are have been in this healthcare fight for a long time that have endorsed what Physicians for Reform and Job Creators Network and other groups have been advocating, including Newt Gingrich, former Speaker of the House, Tom Price, former congressman from Georgia. He actually was an orthopedic surgeon in Georgia for 28 years and a good friend of mine. John Goodman, who's a well-known person, and Steve Moore, the great economist, all endorsing and supporting what we're doing. So I'm very excited to be a part of this group.
Great. Thanks, Dr. Barbour. Just real quick, I know we're coming to the end of our time. I wanted to just point out here, throughout this COVID battle, COVID pandemic for the last 6 months, there is one group of people that have continued to be the most trusted source for information on COVID, and that is doctors by far. And if you look on the bottom right corner, you'll see media all the way at the bottom as far as trust. So keep that in mind as I go to the next slide. I mentioned an advocate program, and we've talked a little bit about this tax cuts fight that we were in. In 2017, JCN recruited about 250 small business owners. We knew we had to get we knew we had the right message. We had to develop the right messengers. And so to get the Tax Cuts and Jobs Act over the finish line, we sought to media train and basically place in the media small business owners to talk about and fight for tax cuts and the value of them. And that's what we did all across the country. During the 6-month campaign, we had over 800 media hits through op-eds and letters to the editor, TV and radio hits, all promoting the same thing. They wanted tax cuts and they wanted them now. We're replicating that exact same program and the success of that advocate program in Healthcare for You, but we're adding into the mix physician voices. And as I mentioned, we've media trained about 60 physicians at this point to get out there and carry that message of patient-centered healthcare. And they don't have to talk about policy because doctors by their very nature are not political. They care about their patients. And so what they can do is talk about patient stories and how their patients are being hurt by the regulations that are in Obamacare and how that's hurt the doctor-patient relationship. So that is one of the centerpieces of our campaign to educate the public on Healthcare for You. This is just some of the media that we've garnered so far. Like I said, it's from national level all the way down to the local level. And like I said, if you're interested in taking a look at the website, it's healthcareforyou.com.
Very nice. Quick question. I noticed when you showed some of your media coverage, it tended to be mostly conservative press. Have you had any opportunities with the left side of the aisle in that regard? What's their receptivity?
We are always happy to talk to everybody on all stripes. I've done some radio actually on some actually Dr. Barbour and I have both done some radio on some liberal radio stations. What I find is that some of the liberal radio stations are very wedded to government-run healthcare and are not as interested in even hearing about options about how patient-centered free market healthcare can work. So it is a difficult conversation to have.
Well, and my question would be though, because obviously if you go on a show and the host or whomever is really just kind of has a vested interest in that position, have you had the chance to talk, like you said, when you went out into the world, to talk to people that are kind of left leaning, but that you're just talking to the actual person, not through some, media filter where they're putting their spin on it and defaming what you do just by default?
Well, right now we are continuing to build our coalition, and we're speaking with leaders on the Hill, both in the House and the Senate side. We've also spoken with people within the White House. So we continue to build a coalition of supporters for the framework for healthcare reform. As I mentioned in the beginning, conservatives, they're very smart and they're very policy oriented in what they want. And unfortunately, in this battle for healthcare reform, conservatives sometimes will let the perfect be the enemy of the good. And we're at a point right now with Healthcare for You that we all agree on the broad strokes of these tenets, of these elements of the framework. And that's what we're so excited about, is we all seem to be kind of holding hands at this point, and it's taken a long time for all the sides to get there. The other side is always so good at you know, sort of jumping on board, hook, line, and sinker. We understand that this is a complicated issue, but we have to be able to talk about it in a way that the American people understand it. And that's kind of where we fall short. And that's why these physicians being out in the media and talking about their patient stories and how they could help, what things need to change so that they can help their patients more, because that's what they want to do. They don't care if it's Democrat or Republican. They want to help their patients more. And if a regulation in Obamacare is preventing them from getting crutches for their patient in a timely manner, you know, that when it matters, then they want to figure out a solution for that.
Absolutely. You know, and all the doctors that we've talked to in our little journey on this too, they're like you said, they're very political. They're like, well, which solution is going to allow me to be the doctor? That's what I want to do. I don't want to be a paper filler in or a code thing. I just want to help people. And you're right. I mean, and once you start to get everyone to coalesce around that, which is why I like your philosophy and your approach of personalized medicine, healthcare for you, it's perfect because you're hitting the exact hot spot for the consumer, whether they're on left side, right, middle, whatever, who knows. We've got some questions, needless to say. So here we go. Kishore, why don't you kick us off? You might have done, there you go.
Okay, so yeah, I mean, this sounds great, and I'm particularly impressed by the coalition you have, excuse me, you built. I quickly went through your framework, and I noticed that you've left out Medicare, and I'm sure it's because of the communication issue. But eventually, I guess you have to deal with Medicare because that is at the center of every single problem in healthcare, right?
Yeah, Dr. Barbour, I don't know if you want to comment on this piece first, because it is a more complicated issue, but that's kind of a separate issue from the healthcare reform that we're trying to focus on right now.
Yeah, you know, it's really a hot button issue. The thing is, you have our seniors that have spent their entire lives paying into a system, counting on that system to be there when they got to that age where they were most vulnerable. So you get somebody who's getting into their 60s and 70s, they've been paying their whole lives into a system, and they need that system to be there because it's too late in the day for them to change course. But the fact of the matter is, Medicare is bankrupt. It does not have any funds, and it has been a Trojan horse for the implementation of government-run healthcare. You know, they started off in the mid-60s with Medicaid and Medicare. Let's take care of the old. Let's take care of the poor. And then S-chip, let's take care of the children. And the problem is these systems don't care for people. They're giant bureaucracies. And I'm telling you, I've worked in these systems for 30 years. There's nothing worse I've ever seen function than a VA hospital, which is a pure government controlled system that cares nothing for patients and is totally inept and incapable of caring for patients. And so what we need to do is create a transition. We need at some point to end Medicare for people who are young, who have the opportunity to change course. And we need to move towards a system that is based on free market, that promotes choice, improves quality and innovation, and decreases cost. And once we do that, then we're going to be able to wean ourselves on Medicare. But our system absolutely supports protecting seniors that are already committed to their dependency on the Medicare system. And so we're never going to do anything to undermine those people. But what we can do is by promoting our framework, people like me, I have an orthopedic practice that I see health insurance. I do not see any government payers, not because I don't care about those people. I actually take care of them for free. But I cannot deal with the bureaucracy because they prevent me from caring for my patients. I can't have people on the phone for 4 weeks trying to negotiate getting crutches for somebody who just had leg surgery. You know what I mean? And so what we want to do is allow individuals to come up with new innovations that are going to, you know, lead us into the new century with modern healthcare techniques. And I'm learning how to deliver that healthcare every day because it's what I do. And there are other doctors in other areas that are developing concierge medicine techniques and and all kinds of things. And we're constantly talking with one another to see the best ways to promote healthcare. And the thing is, if you look at healthcare, anytime where free markets have been allowed to work, you see the greatest healthcare with the most choices at the lowest price. You look at plastic surgery, which has been largely a free market competition system, and it's fabulous care. And if you look at something like laser keratotomy, when it first started, it was expensive. And in a few short years, there's a person who does laser keratotomy on every corner. Anybody pretty much can afford it with the money they have in their wallet, and it's very safe and effective. And they got it now, so you don't miss any time. That's what free market healthcare can do for us. Anywhere where we have government penetration, we see stagnation and no innovation and massively increasing costs. If we were to just look at this coronavirus pandemic, I mean, the way the government has handled this, disinformation, where 1 minute they're telling us to use masks, the next minute they're saying don't use masks, then they say we want to use masks. The medications, they've gotten in the way of the doctor-patient relationship, the whole hydroxychloroquine saga, which it doesn't matter where you fall on that. The point is, doctors and patients should be allowed to explore the healthcare delivery system and the type of healthcare that the patient gets with no interference from government. And during this entire pandemic, we've had nothing but interference from government. And it should show people that we need to go in a different direction.
One thing about what you're saying, Dr. Barbour, for sure, is the fact that by getting people under the age of 65, because obviously not only is Medicare a problem, it's so Social Security too. We don't even want to talk about that today. That by getting people accustomed to the fact that there's options and other things to do will well prepare them for the idea of making Medicare and whatnot. Kind of let's keep everybody that's in it. But now that everyone's younger, like other countries have already done, let's let them opt out into something more free market, and we'll just let the thing fall away by attrition. So that's great. Here, let's hear from Dr. Campbell. This should be interesting. I see you got your hand up.
Oh, gosh. Well, thank you, Dr. Barbour and Elaine. I've been doing healthcare advocacy since 1999. The Job Creators Network has come along, and they could choose to do a lot of different things, but they've chosen to take on healthcare, which is kind of the biggest, hardest thing to do. Small businesses, obviously the cost of healthcare is bankrupting families and small businesses. So I applaud what they're doing. I am amazed at the progress they've made. And I really think that the right side of the political spectrum needs to get behind this. I have been in just the last year, meetings with the top senators and the top House people all in the room at the same time. And unfortunately, the right side has been void of good, innovative solutions for healthcare. And Job Creators Network is bringing the best thing at the table. And we are at a fork in the road where, we may end up with a single payer universal system, which will be really bad. The thing that Dr. Barbour alluded to is right now, those of us inside healthcare, and I've been practicing for 32 years, I've seen the system, it's in spite of 18% of our GDP being spent on it, inside the system is working less and less efficiently. We're delivering less care to fewer people for more dollars. So the system is broken. Job Creators Network, I think, has a great solution. I'm hopeful that we can all get behind it. And it's one of the most exciting things I've ever seen. I want to thank Elaine. They are so capable. And get behind this horse and you'll be on a winning horse. It's either going to be healthcare for you or Medicare for all. And I promise you, Medicare for all is not going to be what you want for you and your children's healthcare. Thank you for Freedom Hub for doing these kinds of topical, very important topical meetings. Thank you so much.
Appreciate that. Let me jump in before you guys respond, because like you said, if we get Medicare for all, and you saw what's happened in all these cities with the defund the police, and all the best police are prematurely retiring. If we get Medicare for all, you think all the doctors are going to stick around and put up with it, or all the good ones going to jump ship?
Yeah,
no, that's an excellent point. And I trained for so many years, and the level of skill that I attained is really, really high. And honestly, I have somebody who is sitting at a Blue Cross Blue Shield office in a cubicle telling me what I can and can't do to manage pain in a patient who has 6 months to live with cancer. And it happens every week. And it's not the way that healthcare is meant to be. And the politicization, the politicians will say whatever they'll say whatever to get their political objectives achieved, but it's not going to be what helps you and your family have health and to be treated in the best optimal manner when you're sick. And if we want to have that, we're going to have to get the Job Creators Network over the finish line with this.
Dr. Campbell, you made my point. It reinforced the point of why we have a physician advocate program where we have physicians speaking out in the media, because in no way did you sound political. You simply told the story of your patients. And when you tell those stories, it's impossible to attack them.
Well, and Freedom Hub, you guys are doing a lot of good work. And if you want to do something really good in healthcare, this is the plan. One of the things that's happened before Physicians for Reform became associated with JCN is C.L. Gray and I, went to the White House and gave them the drug pricing plan, which they've now reintroduced. Certainly the one element of it which is going to be effective, which is getting rid of the middlemen rebates. So we have a lot of really smart doctors who know what's really going on, but what we need is organized political resolve to say, we really want to have good health care for Americans, and we value that more than our own political short-term goals. And JCN, look, they were at the tip of the spear for the most important legislative accomplishment of the Trump administration. And if they can make this happen, this, I think, will surpass the Tax Cut Act in effectiveness for delivering cost savings to Americans. And what better gift can you give Americans than the gift of good health? So I'm all for JCN, and I just hope that I'm convincing enough to get Freedom Hub and all the people on this call to take this seriously and get behind it too. Thank you.
No, that's great. Before I let you guys respond, let's keep some questions going because we're fast running out of time. Mark, I see you've got your hand up.
Yeah, I'll just be real quick. Just a couple of points at the beginning. I actually spoke with David Bell just this last weekend, and our coalition is up to 90,000 physicians now. And the other thing I wanted to mention was the executive orders that were signed just a few weeks ago. We had two of our members there. Mary Tipton's a very good friend. She was right there behind President Trump signing it. And then the third thing I just kind of wanted to identify, Dr. Campbell, you were talking about basically physician burnout. I just did a study and put a number to what's going on with early retirement and all. $31 billion in cost to our healthcare system because doctors are leaving and because they're so frustrated with with what's going on.
I've heard it called Drexit.
Yes, exactly.
Very good. All right, I see Charles, you got your hand up.
Thanks, and I agree with Dr. Campbell and Mark and the rest. Elaine and Dr. Barbour, fantastic presentation and plan and opportunity. If I could put Leah Garcia and Dr. John Taylor on the spot, if you are brave enough to unmute yourself. Leah, in your dealings with small business clients, how would more choices help you help your families and small businesses? And then for Dr. Taylor, as an ambulatory surgical center entrepreneur, how would more choices and competition in your field give patients more choices in the more complex cases where surgery is involved, taking on hospitals and that kind of competition? So Leah or John, if you want to unmute yourself, I think those are both huge upsides to the Healthcare for You plan.
Absolutely. Happy Tuesday, everybody. Can you hear me?
Yes.
Yeah. Wow, what an incredible, this is so mind-blowing. I'm telling you, I'm so excited. I actually specialized in health insurance for many years. And then we had healthcare reform. And really what happened is I saw the writing on the wall. Clients losing their insurance, premiums increasing. They didn't qualify for the tax credits. And now they're looking at their insurance premiums skyrocketing, high deductibles, all those things that all of you are already familiar with. And I saw clients who were literally hurt. Just the story we just heard, people who have diagnoses with cancer and they can't get to the specialist, they can't get the treatments. And so I literally got out of the health insurance industry, specializing just in that because of the fact that it was something I couldn't feel good about. And just like what Jeff and Charles are asking, yes, for health insurance right now, for a small business owner, a lot of them, majority of my clients are going without health insurance, and they're trying to find ways to self-insure because it is financially not possible, especially what's happened with the pandemic. Health insurance is just not a realistic, viable option. They would love to provide benefits to employees, but it's just not realistic. So this sounds like an incredible solution, and I'm excited to hear more. And I definitely going to be on a crusader for this. It sounds like something that is so overdue, so needed. And so my question is, I do have a question really quick. Do you have insurance agents? Because it sounds like there are a lot of physicians involved in this. Do you have insurance agents who you've been reaching out to? Because a lot of them feel like I do, just so you know.
We have not tapped into to insurance agents as part of the market research that we did. When we were speaking with tens of thousands of Americans, we were speaking with patients, doctors, and insurance companies, but did not make insurance agents part of that. But that's something certainly to consider, because you all are very knowledgeable in sort of the end product and seeing how it works or doesn't work in many cases, and also seeing the lack of choice and what you can offer your customers. But with small business, just to make a quick point, since 2013, more than 30% of small businesses have had to drop their health insurance coverage as a result of the rising premiums. And the idea behind Healthcare for You is that it offers a choice for employers. As we roll back the Obamacare regulations that requires a one-size-fits-all in the states, for all the states, because what works in Florida is not going to necessarily work in New Jersey. It's a different population. And so we've got to let these states regulate their own and have the autonomy to regulate their own insurance markets and create vibrant, competitive insurance markets, much the same way we see car insurance and life insurance regulated from state to state. If you move from Florida to Texas, you can keep your insurance company, but it changes based on the regulations of Texas. So the same idea is what Healthcare for You will do, is allow you to have better access to HSAs and expand them, which gives an employer the option, if the employer chooses, to actually get out of the insurance business and fund an HSA as their benefit for the employees. And that way the employees own their insurance policy. And if they lose their job or they change jobs, they take it with them, just like their car insurance, just like their life insurance. Or if they move in and out of the employment market, they own that policy. And that's also goes a long way to helping with pre-existing conditions, because in that case, you never lose your health insurance, therefore you never have that pre-existing condition. It doesn't solve all the problems with pre-existing conditions, but it's one piece of the puzzle.
One interesting point along that line is in our little continual journey, we've been looking for a way to deliver access for the consumer. So we've been very successful converting people to being cash pay. But once they become cash pay, where do they go? It's the challenge. And so we're showing here is a good example of the transition on what you've been saying, is this is kind of almost like the Amazon of healthcare, because it has no dog in the race. It's just a place to go to find everybody that's offering their prices at cash, with no hidden pricing, no upcharge, no facility fees, no anything. Now, the downside is that all the other doctors, as well as all the other consumers, get to see what you charge. So if you're double everybody else and you're the same chiropractor in the same zip code, I'm going to guess you probably don't get too many appointments. But what the doctors like about this is the fact that when I book the appointment and I look it up online and I see what the price is and I pick it, I got to prepay for it at the moment I book the appointment. So now when I arrive at the doctor's office, I show up prepaid. No, and for them to get paid, no coding, no IDC codes, no anything, no waiting, no downgrades, no chasing, nothing. They literally said, Elaine came today, I gave her that adjustment, or she had that MRI, and bang, I'm paid. So this allows us as consumers to get back control. And for a lot of stuff, most things, I don't really need insurance. Because, you know, I always tell everybody, and you'll appreciate this, as an analogy with your home, if my house burns down, that's when I need the insurance. I don't need the insurance to get the lawn mowed. So there's a lot you do where you don't really want to use insurance because it's just going to increase the cost of the insurance for the things you really do need it for. This has been a very interesting compromise we've found, and that's why I played into that image I was showing with the, which I love this particular image here, if you guys have seen this one in the past, but it's so apropos. And most of the doctors we work with says, if there's any which way I could become a doctor again, I would be a happy person. But everything is thwarting them like you've described.
Well, what we know is that the cost of healthcare is not the real cost. It's the cost and the complexity of the system, the bureaucracy. And if we can reduce that complexity, we can take costs out of the system and we can improve healthcare and improve the doctor-patient relationship. And as these insurance markets are able to be created in the states and they're vibrant competitive markets and the cost of healthcare continues to come down, there'll be more choice and more options for people to choose from, and the price transparency will come as well. I mean, when you have, I shopped for my children's braces, and you'd be shocked at the price differences there. It happens in healthcare, it in different areas. I mean, Dr. Barbour mentioned LASIK surgery. That's come down 50%, and now you see coupons in the paper for it. So that's where you have free market healthcare, where it's working and innovation, the procedure gets better because of competition.
And you know, the sad reality is that the doctors that we typically encounter are really, really good because we see them from that side. But if I'm a consumer approaching it, everything seems terrible. I can't even appreciate that they're good doctors in the system. I think everything stinks because I never get to see them in their real light, the way they're supposed to operate. So I want to thank you guys so much for coming today. That was fantastic.
Thank you very much for hosting this. This was great.
Thanks for having us.
We'll have this released and it'll be up and running on Monday. You'll be able to find it on any of these links here at the bottom, whichever preferred system you prefer. And as you can see, there'll be an awful lot to look forward to coming up. So again, thanks everyone for coming today.
Thank you.
Thank you.